think we're starting now.
Okay. Hi everyone, welcome back to another session with Fresh Dental Shadowing. Today we have Dr. Kwon, and she's a cosmetic and general dentist. And yeah, take it away whenever you're ready, doctor.
All right. Good afternoon, everyone. My name is Dr. Kwon. I'm a general dentist practicing out in California. When I was asked to join this webinar, I was very thrilled because I've been working as a pre-dental advisor throughout dental school and beyond. So it is my passion to nurture the next generation of dentists. So I hope this session is as meaningful and beneficial for you guys. So without further ado, I'll get right into it. So this is the outline of my presentation today. I'll talk about myself a little bit, and then I'll get into or introduce what general dentistry is all about. And I'll go over some cases to kind of give you an idea of what we do as a general dentist. And I will share some advice and thoughts for pre-dental students. And then I want to spend a lot of time on Q&A, so feel free to ask me a lot of questions, and then the organizers will give you guys a quiz. So a little bit of background about myself. I'm from Seoul, Korea. I grew up in Korea, and then I moved to Michigan as an exchange student in my sophomore year. And then I did a little bit of community college out in Michigan, still trying to decide what to do with my career. So I was considering nursing in the beginning. But then, to make a long story short, I decided to go for dental degree. So like most pre-dental and pre-med students, I majored in biology at Gordon College, just outside of Boston. And because I was an international student, there were a lot of restrictions as to what school I can apply to. So I pretty much applied to all the schools that had no restrictions for international students. So mostly private schools and some state schools. So I got into Harvard, UCSF, University of Michigan, UPenn, Indiana University, and USC. And I was already working in Boston, so it was convenient for me to go to Harvard. It was actually relatively cheaper compared to other private schools. So I earned my DMD from Harvard, and then I moved on to a one-year general practice residency at Rancho Los Amigos National Rehab Center in Downey, California. So this is the definition, or this is what WebMD defined as for a general dentist. A general dentist is your primary care dental provider who diagnoses, treats, and manages your overall oral health care needs, including gum care, root canals, fillings, crowns, veneers, bridges, and preventative education. And I thought this was a pretty comprehensive definition and pretty well defined. To add a little bit to that definition, we do some surgeries as well. And the reason why I chose general dentistry is because of its versatility and freedom. Because as a general dentist, which you can see later in my slides, we can choose what kind of procedures we want to do and we don't want to do. And if we want to develop the skills further into certain specialty, we can as a general dentist. But if you want to refer out some procedures that you don't feel comfortable with, you have the freedom to refer them out. So you can do as much or as little as possible as a general dentist. So the difference between the GP versus specialty is obviously a compensation, especially if you're an associate. The percentage of pay is different between the general practitioner and the specialist, even though you're doing the same procedure. However, this can also change depending your comfort level, your expertise, and your experience level. You can definitely ask for more if you are competent and if you can perform as good of service or even better service than a specialist. And if you're an owner of the practice, you can definitely charge whatever fees that you want. So, like I said, GP has a lot of potential to grow financially and procedure-wise. So to become a general dentist, you need to do the 4 years of undergrad. And for me, I took 1 year off after undergrad to get more hands-on experience. So I worked as a dental assistant for about a year, which I thought was so very beneficial, even to this day. Without that experience, the dental school, the transition would have not been as easy. And the things that I know as a dentist, and I also know what dental assistant, what your expectation is for your assistant. So that was a game changer. So if you can have a chance to assist as an assistant professionally, or more like as a shadower, I strongly encourage you to do that. And definitely 4 years of dental school. And I did 1 year of residency. It's either GPR or AEGD, but either option can prepare you to become a general practitioner. And I strongly recommend doing this residency, although you don't need to do the GPR or AEGD to practice dentistry after dental school. Honestly, 4 years of dental school experience does not prepare you to practice in the real world, at least to the speed that the real world dentist practices. So that 1 year of residency, I think, should be a must if you want to jump right into the real world of dentistry. And now I've been practicing in a private practice for over 5 years, and that is me seeing a patient for a consultation, and that was the day that my daughter visited me. And here is the picture of me treating sedated patients during my residency. The residency saw a lot of medically compromised patients, so we did a lot of sedation cases and full mouth rehab under GA. So that was a very unique experience. As I mentioned earlier, I am practicing in Orange County, California. I actually work at 3 different offices, and the picture below is almost like my home office, but all 3 different offices have very different patient and staff dynamic, office environment, and whatnot, and yet I actually do love every office that I work in, so I don't want to give up on either. So I'm kind of enjoying the diversity. So anyhow, so if you are lucky like me, landing at the job that you want from the get-go, that's great. But I've read an article that the average or the graduating dentists in their early career, they change their job every 3 to 6 months before they land on the job that you want. So for me, I also tried out 3 different offices before I landed on the current offices. And if you have the luxury to choose what office you want to work at, things that I would consider is the mentorship by the senior or the owner dentist, because as I mentioned, right after dental school, you probably don't feel prepared to do. For example, I was thrown into doing an extraction and bone graft, which I've never done in dental school. And the patient was scheduled for 30 minutes. Boom, there you go. You go do extraction and bone graft. And I was like giving them an eye, like, are you serious? But they're like, yeah, it's like a routine procedure for, the experienced dentist. So this was like a few days after I started working at my first job. So, but if you have a mentor type of figure in-house, you can go ask and they can definitely guide you, and that's how you grow your skill sets. So having that mentorship is great. And having good staff is tremendously important, because having well-trained staff will be a game changer. They will make your day run smoothly, the patient communication so much better. Usually patients leave happier if the staff treats them well with knowledge and the right chairside manner. And also, well-trained staff can schedule your day effectively so that you're not totally overbooked, and yet you're booked enough to be productive in an effective manner. So that really helps. And your practice philosophy is huge. If your office is all about just making money, not caring about patients, it can bite you later, even though you may be making more money by your office manager or the treatment coordinator pushing the treatments. Yeah, that'd be great, but you have to have the final say whether it's beneficial for the patient or not. So you have to make that final call. But some offices, sadly, these days, for example, some corporate offices tend to push for certain procedures against the doctor's recommendations. It hasn't happened to my career, but I hear some stories. So you have to be diligent, or you have to do your due diligence to figure out what kind of practice is, what kind of philosophy the office holds before you commit yourself to the office. But you usually would not have the luxury to figure all that out before you actually start working for them. So make some mistakes and just try out different offices once you graduate, and then you will kind of figure out what you want and what you don't want. And then you can definitely train your staff, or you can develop your own culture. Or another option would be just opening your own practice. So I'll get into the meat of today's presentation, which are some of my case studies. The first case involves, or is a combination of prosthodontics and surgeries. Prosthodontics is, we jokingly says it's a glorified version of general practice dentistry. It has to do with crowns, bridges, and full mouth rehab cases where the patient is to transform their smile in a more harmonious way universally. So this patient came in wanting to regain the smile that she used to have. And when I probed further, she mentioned that my teeth used to be longer when I smiled. I used to show more longer teeth and wider teeth. And now, obviously, due to cavities and all the patch-up of work, she is missing multiple teeth, some cavities, stains, and shorter front teeth. So this is the pre-op photos. And this is the occlusal view. You can see that there is a cavity. You cannot see my cursor here. So anyhow, there are some broken teeth, old fillings and crowns with ill-fitting margins, big amalgam fillings, and missing teeth and whatnot. But due to her financial constraints, she could only afford to do the upper arch work. So on the left side, this is all the lab work that had to be done between her first visit and the second visit, which was the actual surgery date. So we had to order some diagnostic wax, which is shown in the right side. So this is pretty much a mock-up, pretty much like a model that was made onto the existing tooth model or teeth model to kind of for us to foresee what the final outcome would be. So if the patient approves of the diagnostic wax up in terms of the aesthetics, then we go ahead and prep the teeth. So I prepped the teeth. I did the surgeries that day, so it was a little bit bloody. I took out the very last tooth on the upper right side, which is the upper left for the patient, and I did the extraction, bone graft, and implant the same day. On the right side, I made the temporaries based off of the wax of the laminate. So this is the test driver. The patient will go home with this and try it out, eating food and whatnot, speech for a couple of weeks. And if there's any modification that we need to make, then we do that for the temporaries. And with the modifications that we made, if everything is good in terms of the aesthetics and function, then we take the impression of the modified temporaries and we send it to the lab for the final crown fabrication. So this is the final crowns that we delivered. You see how the teeth are much longer, more harmonious, without the stain, obviously, better texture and whatnot. The upper left side, for the patient's upper left, on your screen, upper right side, seems still empty because the implant was placed and it still needed some time to heal, about 3 to 4 months. So without that, everything else was delivered. And you can see that the patient is wearing the partial denture on the bottom. And you can see the healing abutment that is there. We had to wait for another 2 months after the delivery. And at the end, I'll show you what it looked like once we deliver the restored implant. So you can compare the pre-op, the temporaries, and the post-op. The third picture on the right is prior to place or restoring the implant, but still you can see the transition, and the smile is much fuller, the teeth are longer following her lower lip line, which gives you the very beautiful look. And the bottom picture is after delivering the final implant crown. Once again, the smile looks much fuller. So this patient cried at every visit, seeing the temporaries, the final, and after delivering the implant crown, she was so ecstatic to see her new smile. She actually got a boyfriend after getting the final crowns, and she's actually going to New York this week, I believe, to see her boyfriend. So that was life transforming for her. The second case involves orthodontics and prosthodontics. In orthodontics, most people know it as the braces, for braces, but orthodontics is done not only to improve the aesthetics, but also for function and to prevent any potential issues that come from malposition or malaligned teeth. As a general practitioner, I do a lot of Invisaligns as opposed to braces, not because it's better, but because that's within my comfort level and training. But obviously for severe cases, I refer the cases to the orthodontist or OMFS, the oral surgeons, to correct the jaw position and whatnot. So this patient came in wanting the Hollywood smile. He actually was in he was getting a bridge work done by another dentist, and this is how he came in with some temporary work and very worn teeth and some crowding and spacing. As you can see on the right side, which is the patient's right side, that's on the left side of your screen, the teeth are very slanted inward. The front teeth are on edge-to-edge position, which is not healthy, and some spacing on the left side, which is the right picture. So I suggested that we align the teeth so that they're in an ideal position before we can do some ideal crown and bridge work. And he agreed because he wanted the perfect smile, and he knew that it would take multiple procedures to get to that. So patient education is very important because a lot of times patients just sees a commercial in Hollywood Smile and they think that they can just get that by bleaching their teeth and getting some veneers and crowns done, not understanding how teeth should be positioned for the more predictable outcome or ideal outcome. Thankfully, this patient understood or appreciated the prep work to get to that point. So, like I mentioned, he had some crowding and spacing and misalignment and partial edentulosum on the upper jaw. So, I wanted to show you how his Invisalign simulation worked, but the technical difficulties here. So, this is before, and then I did. He was in Invisalign treatment for about 10 months. And then once everything was in the better position, I made the crowns and bridges and see how symmetric and nicely aligned his teeth are in terms of the relationship of the top teeth to the bottom teeth. So that really will guarantee the predictable outcome and function, not only the aesthetics. Okay, the third case, I'm gonna show you my surgery cases. I actually do love surgeries, third molar extractions and implant placements, and some frenectomy or some gum procedures or periodontal procedures. The one that I do often is frenectomy. So immediate implant placement is where we extract the tooth and then place the implant on the same day. This is more predictable as our research shows the predictability of it. Of course, you have to select the right cases in order for us to be successfully do this kind of stuff. But for this kind of case where the patient came in with fractured tooth, it was a perfect case. And the patient actually had the partial denture, as you can see on the lower right side. So that was a perfect case. I extracted the tooth. It has to come out atraumatically without breaking the bone around it or the tissue around it. So literally you just pluck out the tooth very carefully and place the implant and then the bone around it. And then the rest of the body will heal as long as you do this in a very careful manner, making sure that the bone is present all the way around, that empty bone where the socket was and then the implant goes in, it will be filled up with the bone. So we didn't let that heal for about 3 months. I'm not sure if I included the final photo. This is another case which was a perfect for immediate implant placement. The patient came in with a loose tooth, which is the one in the middle that has some bone loss, as you can see. And when I luxated the tooth was very loose. It was actually the long post got broken in the middle. So literally I could just pull out the crown along with the post, but the root was intact. So he had the bone all the way around except for the bone loss that goes this way, which we call mesial, towards the midline. So I extract that tooth very atraumatically. You can see that the soft tissue and the bone is almost intact. Obviously, it's a little bit bruised and whatnot. But the most important is keeping that buccal, which is towards the lip. That tissue has to be very intact along with the bone because that has the very thin bone. And once that's gone, then the blood supply gets cut off. So, and then the predictability goes down. And you have to position the implant a little bit more lingually, meaning towards the palate rather than towards the lip. And then this is the temporary that I'm making off of his existing crown that we extracted. And we have to place enough bone graft so that the tissue contour can be preserved. And I usually shave down the length of it a little bit short so that the patient doesn't actually occlude or function with it while the implant is getting healed. So this was actually 1 week post-op. You see how healthier the tissue looks, although aesthetic isn't there, we want to just let that heal, and I eventually changed up the temporary as we got close to the final restoration date. I recently actually delivered that crown, but I didn't get a chance to take a photo that day. My next case involves restorative and surgeries. So this is one of the common consequences of root canal treatments. The tooth gets very weak, and then a lot of times patients with a very strong bite force, they can fracture the tooth at the neckline, which what we call cervical margin. So, and if you have deep cavities, should you just try to save, or should you recommend a more invasive procedure like extraction and implants? So in this case, well, this patient, the previous dentist attempted to save that tooth and did the root canal, but as you can see, it got fractured at the neck of the tooth. So we extracted the tooth for the predictability. If the patient insists on saving the tooth, we can definitely place a post and put a crown over that. But given that this is a very last tooth, which is a fulcrum point of your jaw, it will undergo a lot of force. So in this case, I recommended extracting the tooth and then placing 2 implants for more predictability. So the treatment planning matters. We can do all kinds of procedures that the patients wants, but we need to guide them on the predictability and the longevity. Obviously, patients would know because once they get the crown, it looks like a crown, a well-functioning tooth, but they don't know what's underneath it, the condition of it. So we have to inform the patients of their multiple options so that they can make informed decision. And yet you need to kind of guide them on what would be the best for them. My next case it shows a periodontal surgery. In this case, I did the gum surgeries for the aesthetic purposes. This patient came in saying that one of her old veneers popped out, and this is how she walked around, and she said she is pretty happy with her smile, but when I looked at that was not okay with me. So I kind of helped her how I could improve her smile, and she decided to get the gum surgery for more harmonious gum level. And this was the day of the gingivectomy, the gum surgery, and I did the veneer prep as well. And this was the same day she left with the temporaries. I wish I could cut a little bit more on the upper right side, which is number 9, but there is a biological width that we have to respect, so there was only so much of a cutting that I could do. But anyhow, she came back 4 weeks later for the final veneer delivery. I mean, she was a little bit numb, so she can smile evenly, but you can see the big difference from the beginning and 4 weeks later. So now we have technology like laser and electrosurge. So these procedures can be done very predictably, painless, fast, and heals pretty well. So that's one thing that we can do as a general dentist as well. Next case is cosmetic dentistry. So cosmetic dentistry requires a lot of treatment planning and planning before we execute our plan. Without that, it could lead you to a catastrophic result. So good diagnostic wax-up or mock-up, which I showed you earlier, is very, very important. And having temporaries to test drive how it's gonna work. That is very, very important. This patient obviously has a lot of wear and a lot of things to be done. And he did not want to do any invasive procedures like surgeries, grinding down teeth, and he had a tight budget too. So I did what's called a mock-up. Literally, I added some composites onto his teeth to kind of show him what his teeth can look like. I didn't do any kind of prep. I literally bonded the composite on there. So you can kind of see the transition and whatnot. But this is an alternative to the wax, which costs quite a lot of money. The lab actually does all the manual work, so it's several $100s. But for those who cannot afford that, you can offer this kind of chairside mock-up as well. And this is more ideal way of going about it. Not ideal, more like it's an alternative. The chairside mock-up also works. Okay, so the second cosmetic case. This patient, I was actually working on her lower denture. It was actually an overdenture case. But when she came back to try on the teeth setup with the bottom denture, I noticed that she had a reverse smile line. Even to a layman's eye, you can tell that something's not right about her smile. That's because her smile line does not follow her lower lip line. So I suggested doing the veneer prep to correct the smile line. So I did the veneer prep. And this is after the veneer delivery. You can dramatically see the difference. She looks so much younger with the correct smile line. So seeing that as a patient, she might not even realize because she can eat fine and she doesn't know what has happened in the past. But when I asked her to look back at her old pictures when she was younger, something would look definitely different. And she did notice that, and she appreciated that I pointed that out. So as a professional, you're supposed to look things out for her. Without us correcting that smile line, she would have had an ugly denture that comes up this way. So it's really important for you to develop that eye for cosmetics. The next case is an overdenture case. Overdenture is a denture that gets clipped onto implants. So for patients who are on a budget, who cannot afford a fixed option where they can get multiple implants completely fixed, patients who had dentures but had issues with the dentures being loose, we can place a minimal number of implants so that the denture can clip onto the implants. So sorry, this picture is a little bit graphic, but this patient came in with only 4 teeth remaining. She had a pretty good bone, and obviously she had a tight budget, so she couldn't afford to do a full arch fixed option. So I suggested overdenture options. So I extracted the teeth and placed the implants on the same day. This is actually another patient. She had a very, very thin bone on the bottom, and those were the only spots where I could place implants. And that's the inside of the overdenture. And you can kind of see the female and male part where they can engage together. So let's see. This is a patient who is clipping in her overdenture. She has a denture on top, but it's always the bottom denture that has issues with moving because of the tongue, and unlike the upper arch, the bottom has only that thin U-shaped bone, so there is not much area for retention. So patients who's had dentures, the bottom dentures without implants definitely appreciate the upgrade. And this is another patient.
It's kind of when I leave it, they were kind of pretty bad. When they wash, it's kind
So look at the retention. I tried to pull it out. It doesn't come out.
Can you say 61? 61? 51? 61? Yeah. 62? Yeah. 62? 63? 63?
Great phonetics.
64?
Good aesthetics.
65? 66?
And I haven't seen the patient since then, which was about a year ago. So that means she's doing pretty well with this. So this is the the left side is the lady with the 4 teeth, and that was her overdenture. And so yeah, they gained a pretty natural smile with this. This is my last case, and it was actually one of the most challenging cases that I've done recently. So I wanted to share this with you. I want you to take a moment to kind of examine, look at her smile and think of things that don't seem quite right. I wish I could hear your voices, but say it to yourself, and let's move on to the next picture. This is the close-up pre-op photo, and you can clearly see now something's wrong, right? Yes? Even more clear, right? So this patient actually has a midline that is way off to the patient's left side. And that's because she's congenitally missing one of her premolars on the upper left side, which is on the right side of your screen. So she went through 3 years of braces to correct that. But I don't know what happened there. The orthodontist could not achieve the outcome that she wanted, and the patient ended up with almost like an edge-to-edge bite, very slanted teeth, slanted this way, or not like this. So the patient was very unhappy, and she's a very, very gorgeous woman. So just that midline was very sticking out, and this is how it should be. And Tom Cruise is actually one of the well-known public figures with a very off midline. But clearly for him, it doesn't bother him, but for my patient, it definitely did. So she actually went to see several dentists for consultation. She said, no more braces. I just want to do this in a faster manner. And some of other doctors that she saw recommended just 4 or 6 veneers to fix this problem. And when I heard that, I said, no, that is not possible with veneer, because literally you have to cut that much of the tooth structure to move the midline. So doing it only with 4 veneers could end up being pretty awful. So we did a mock-up, because I recommended doing crown scrimmage on all teeth that show. So this was a diagnostic wax up, and I still wasn't too happy because the midline was still about 2 millimeters off. So I sent the case back. So, and then this was the first delivery, and see what you think of this. Would you be happy with this? Right. I mean, compared to the original condition, yes, her edge-to-edge bite is addressed, but the midline is still off, and the teeth are still very slanted. So I didn't see a whole lot of improvements. And so I said, no, I don't think this will satisfy me or the patient. So I sent back the case. Oh, I don't know why it's doing that. So as mentioned, this is the first attempt. The midline is still off. So I sent back the first wax up and came back with a better aligned wax up, and I did the mock-up with, or did the temporaries with this, and the midline was much more aligned. I mean, the midline on the bottom teeth is slightly shifted to patient's right, so it seems like it's off, but the midline on the upper with the temporaries is aligned with her midline of the nose. But the trade-off was that because the roots, the base of the teeth are still where they were, by shifting the midline with the temporaries or crowns, you could see the severe curvature from the gum line. And that was the trade-off. And I informed her in advance. And as long as she understood that, she was okay. Thankfully, she had a very low lip line. So even if she smiled big, she only showed the end of her crowns. So that's why I had her retract her lip with her fingers, so that I can show a little bit more of the temporaries body. So with that, we're pretty happy. And this is how they ended the case. And that's the most exaggerated smile that she shows. So clearly it doesn't show the gum line. But the upper two central incisors had to be connected or splinted in our terminology, because remember, I had to shave significantly of the upper right teeth, which is the left tooth in the screen, to shift the midline. So by doing so, we had to strengthen the zirconia, the material. So we had to splint them together to make up for the thin zirconia, for more predictable or more long-term success of these crowns. So for cosmetic cases, you have to understand what compromises you have to make and what could be the trade-off would be. Because obviously nothing is better than having healthy, normal teeth of your own. But when a procedure is done, it is already invasive, because you have to already cut out your natural teeth structure and whatnot. And especially for this case, the midline should have been ideally shifted by braces, but she didn't want to do that. So this was an alternative, and this was the best we could do by shaving down her teeth. But we did achieve the result that she wanted. So from the top teeth, which is her original bite, to the first try, which had a very slanted teeth. I mean, that could have looked fine for some people, but I think you can write a slant down that slope. It was very slanted forward. I did not like that personally. And the final, I like the contour. It's very feminine and looks good with her smile line. So I was happy with that. So in summary, general practitioner or general practice dentistry is an interdisciplinary specialty, because you're the one who's making the bridges, and you can combine all this different specialty work to achieve the goal that the patient wants. And it's important for you to learn what your strength and weaknesses are. And you need to learn, okay, this is my limit. I need to triage these cases instead of trying to be a superhero. Because, I mean, everyone has strength and forte, so specialties or specialists exist for a reason. You don't have to do everything under one roof. So it's about the patient care, not about how great you feel about yourself as a dentist. And definitely, so with the same note, definitely acknowledge that we're not superheroes or God. we can tell patients some things are not feasible, some things are feasible. And cosmetic dentistry should be based on function instead of only the look. The last case that I showed you, if I did not splint the front two teeth, then I don't know how long the crowns will last without or before fracturing them. So you need to understand what kind of dynamic of chewing will bring to your work. The future of dentistry, like I mentioned, you do have the option of going right into a general practice dentistry or a real world dentistry or specializing after dental school. And you can also go into academia or commit yourself into private practice settings. Or there are also community clinics and whatnot. And there are private practices versus corporate offices. And there's no one right choice. Everyone has different personality, and you may like this one thing and another person may not like the same career path that you took. So you have to try it out for yourself. Through trials and errors, you can probably make the best decision for yourself. And the dentistry is changing quite rapidly. Things are moving more into the digital realm. But dentistry always lags as opposed to other medical fields, which I think evolves quite fast. Dentistry always likes to hold on to the traditional methods. And it actually works, and the time proved it. But I'm sure you guys will learn by the time you guys start dental school, things may be all digitized, who knows, but definitely having solid understanding of the traditional way will prepare you better for the digital age. And lastly, for you pre-dental students, I want you to keep asking questions and questioning about your career choices. I mean, just because you're pre-dental students, you're not already committing yourself to dental school. It is a very expensive investment. So before making the commitment, I want you to really evaluate if this is for you. Even taking the year off just to try out different fields, not only dental, but you could volunteer or work at a different medical branch, so that when you actually get into dental school, you'll be happy with your decision. I had a classmate in our last few months in dental school, she realized that it wasn't for her. But she still took the boards and everything. But she is actually not practicing as a dentist at all. She's working in a medical corporate world. So that kind of investment, I mean, having that DMD degree from Harvard can carry you to different, maybe nicer career path, but the 4 years in the clinic and whatnot, I don't know if it was all worth it. So with that said, I think we can get into the Q&A session. Oh, and that's my husband getting treated by me. And that's one of the reasons why I became a dentist, because my parents both had a lot of dental issues and they couldn't afford it at the time. So I was thinking, okay, I need to find a career that I could utilize for my parents. Yeah, who knew I would marry a guy who has so many issues with his teeth. So there you go. So with that said, I am going to open up this time for questions.
All right, thank you so much, Doctor. That was an awesome presentation and really insightful. So I think we can start with our questions now from the YouTube live chat. Okay, so on the last slide, you had like corporate dentistry versus private practice. So can you just like kind of talk about the difference between the two? And
Sure. So corporate offices, are emerging quite rapidly, and that's the kind of the business model that a lot of people want to go for. Whereas private practices are owned by an individual rather than a corporate. So the clear difference is that the corporate offices are run by a system rather than a person. So even though you're the doctor, the system requires to meet certain productions and whatnot, and it's more like a factory work. It's very methodical, whereas private practice there is more one-on-one care. I cannot generalize it for all corporate offices. I've worked in a corporate office that got bought out by a private owner. It actually runs pretty similarly. I guess it depends on what kind of corporate it is and what kind of philosophy that the corporate owner or even the office manager has. Because some offices are very caring, even though they're corporate offices. And if the doctor who works at the corporate office is fast and very experienced, even the corporate offices can run much like private practices. But the sheer volume of patients, obviously corporate offices brings in more volume of patients because they send out massive marketing flyers, TV marketing and whatnot. So whereas private practices, patients actually search for you. They actually look at your websites and they learn about the doctors. In the private practices, the doctor usually stays for a long time. Whereas corporate offices, because it's like volume, production, the associate dentists tend to get worn out easily, and there's a lot of turnover. So patients don't see the continuum of care, whereas a private practice, these two offices that I work at, it's been owned by the same person. One doctor is now 80. He's been owning the practice for 35 years. So he's seen these patients like generation after generation. He knows the whole family history. They're like friends, family and friends to them. The other office, the owner has owned that practice for 15 years. So they know that they will be taken care by this doctor and he's not going to go anywhere. Whereas some corporate offices, the patients come back and they're like, oh, who are you? Like, you're not the one who did the work on me. But they cannot track down the doctor. So the new doctor kind of picks it up from where it's left off. So the care isn't so harmonious or continuous. In terms of the compensation, it takes a lot of investment, time and money-wise, to run an office. That's why, for me, I think it's better to work as an associate rather than being a business owner, because these days to compete with the corporate offices, you have to spend so much money on marketing and whatnot. We just had a marketing or a session with a firm that actually flew out the marketing team to our office, and we did like 3 hours of video testimonial, 2-day long, and they spent tens of thousands of dollars for this marketing purposes. But corporate offices, they obviously do massive marketing, but with one kind of marketing, they bring in all these patients to multiple offices. So it's really hard to compete financially with the corporate world. And sometimes for that reason, corporate offices tend to pay the graduating dentist more, and they tend to hire you out of school, because a lot of times the graduating dentists are money hungry. They're willing to just work, but the work may not be to the standard that the patients expect. So there could be a lot of complaints and whatnot. So it's important for you to gain expert. You need to start somewhere. So whether it be private practices or corporate offices, I think you will gain great experience either way. But as you build your experience, skill sets, and whatnot, you may want to kind of venture out more opportunities where you can see yourself for a long term, if that helps you.
Yeah, that makes sense. And then somebody asked, what would you say is like the biggest difference between dental school and then like residency and practicing in the real world?
Definitely the speed. In dental school, like I think maximum that we were allowed to book was 2 patients in the morning, 2 patients in the afternoon. I think we were given 4 hours for prom prep, and 1 hour or 2 for cleaning. But in real world, cleaning like 30 minutes, crown prep 30 minutes. Like you have no time to mess around, and then you're usually double or triple booked. So you have to go in and out, work very efficiently. I usually have my patients put the topical anesthetic and take the preliminary impression, and then I'm doing other work with my other patients. Come back, inject, anesthetize, go do see other patients, come back, prep the teeth in a matter of 15 to 20 minutes, make the temporary, go out, see other patients while the temporary is sitting, come back, adjust the temporary, cement, and while the temporary is being cemented, I go see other patients. So the workflow has to be very efficient. I don't have to sit there with the patients the whole time, obviously. Assistants are there to make you more productive. That's actual the job description of dental assistant, I think. Yeah, so it's not that you don't care or you're just working just hastily, but you have to work efficiently and systematically and know when to leave and when to stay.
Yeah, so like how many patients would you say that you see in a day, and like what are the hours like?
So 2 of my offices, I'm there all day, 8 to 5 or 9 to 6. I see about 20 patients or so, or less, 15 to 20. I'm doing more of a surgical stuff these days, so I don't want too many interruptions, but with including new patients, checkups, and actual procedures. Yeah, I see about 15 to 20 patients depending on which office. And one office that I go to, I go in more like a specialist doing root canals and implants only. So for that office, it's only whoever they booked for that procedure only. I don't have to do any new patient exam or recall exams. So that's a little bit more manageable. I guess actually that's a good point. The difference between a general practitioner versus a specialist is that specialists, you don't have to hop around from room to room a whole lot because you are just dedicated to see that one patient for that one specific procedure that the office made for you. Whereas the general practitioner, you have to do a lot of consultations, spending time with them, making them understand their needs and treatment planning, things like that. So if you want to say it's a little bit more time consuming or you spend more time with the patients, whereas the specialist is more like you go in, do the work, and go home.
Okay, thank you. And then somebody asked, what factors should one consider when applying to dental school? And then, like, overall, just how was your experience at Harvard?
Definitely, if you can take out the minimum amount of loan, that's huge because it is a big investment. Like I mentioned, I took out about $250K for my DMD degree, plus I had to take out additional like $20K for my credit card loan because the financing company only gave me $250K. So it has to make sense because if you're just going for the dental degree because you're thinking that you can make a big buck being a dentist, not quite, because it depends on how much money you put into it. So you have to think of the return on investment. So if you honestly, any dental school I feel like will prepare you to become a dentist, and like I said, doing a residency makes a big difference. So if you can take out the lease loan, if you can get into your state school, that would be the ideal situation. But for myself, I mean, I was an international student, so whoever gave me the loan, period, I did not have any choice. And thankfully, Harvard was one of the few who landed money to international students. So that was the decision factor for me. Harvard is a very, or dental class is a very small class. My class was about 35 students. And at my time, we took the general science courses with the medical students. We actually went to the medical school classes, and then we did all the hospital rotations, and we even did the gynecology exams and things like that. So we had a very extensive medical training on top of the dental. But I think they modified the curriculum so that the dental students spend a little bit more dental clinical time. So I think things are a little bit shifting. I mean, both have pros and cons. I mean, given that I was extensively trained in the medical or in medicine, I can communicate with other medical or MDs if there are like medically compromised patients cases. My communication with MDs is much smoother, and my understanding of the patient's medical background is better, I would say, or I feel comfortable seeing such patients. But any dental school, I mean, as long as they are accredited, I'm sure they have a pretty good curriculum. And it's really about what you make out of dental school. And beyond dental school, you have to take extensive CE courses to keep your license active. And that's how you will really hone your skills and refine your skill sets and knowledge.
Okay, thank you so much, Doctor. Those are all the questions we had. And yeah, we really, really appreciate your time and all your responses.
Of course. Thank you so much. And you can reach me on my Instagram or email address at the end. So feel free to contact me